Hi, I'm Dr. Tunde-Byass. I am an obstetrician and gynecologist from the North York area. Today we'll be talking about updates on our pandemic in pregnancy series. So in the last few weeks, there's been new data from the Center for Disease Control in the United States and also from the obstetrical surveillance department in the UK. So according to the two data, the risk of death is actually very low. In the United States, it is said that there's no death in pregnant women with COVID-19. And in the UK, it's actually 1%. The outcomes, fortunately, are good. Like I said, the risk of death is low. However, the risk of severe illness with COVID-19 in pregnancy is increased. That leads to increased need for hospitalization, ICU admission, and also the need for mechanical ventilation. Data show that the risk of transmission from the mother to the baby, it's uncommon. So that's good news. So talking about vertical transmission, we can say the risk is negligible. Both data shows disproportionately increased risk in non-white women. The studies in the United States looked at Hispanics and Hispanic Black women, and the UK, they look at the Asian, and they also look at Black women. And in all the categories, the risk is much higher. So I think pregnant women, you need to be reassured that the risk of transmission is low. If you're going to get the disease, it could be severe. And most women will come in the second and third trimester. You need to know that if you're sick from COVID-19, there's a high risk of hospitalization. There's a high risk that you may need ICU admission or to be on the ventilator. I think it's very important to take this disease seriously. If you're considered high risk, you may need more appointment with your obstetrician. If you have any symptoms that may be suggestive of COVID-19, like cough, fever, shortness of breath, of course you need to seek help. And if you have any symptoms, you can get a COVID-19 testing. It's free in Ontario. What you also need to know is the fact that the public health, your local public health unit, will be bringing out different advices. You need to adhere to those things. More importantly, hand wash technique. You can never have too much of that. Also, the use of face mask. If you're out there in a shopping area, closed space, make sure you have your face mask on. And of course, social distancing. As much as possible, you want to stay 6 feet away from the next person. By doing that, the risk of infection and transmission to you should be low. Thank you and good luck, and please remember to fill our survey.